What if that chest pain and racing heart isn't a heart attack at all? Many Malaysians rush to the emergency room only to be told their heart is perfectly fine. But the pain and breathlessness they feel are completely real. Here's what most people don't know about how anxiety physically hijacks the body. By the end of this video, you'll know exactly what to look for. Let me explain what's actually going on. Anxiety itself is a natural, healthy emotion. Think of it as your body's built-in security team. When faced with danger, your brain releases adrenaline, triggering a fight or flight response to help you survive. Today, our dangers aren't wild animals. They are daily stressors like exams, family issues, or financial worries. Feeling nervous before a major life event, like getting married or starting a new job, is completely normal. It's a temporary feeling that goes away once the event is over. But when does normal worry become an anxiety disorder? It happens when that internal security team gets stuck on high alert. The fear becomes uncontrollable, long-lasting, and completely out of proportion to whatever triggered it in the first place. You might feel a constant, overwhelming sense of dread, even without an immediate threat. This constant state of alarm starts to cause significant impairment. It begins to affect your personal relationships, your performance at work, and your day-to-day living. When anxiety stops you from functioning normally, it has crossed the line into a medical disorder. It's no longer just feeling stressed. It's a condition that needs proper attention. Here's what's actually happening in your body. Anxiety isn't just in your mind. It causes severe physical symptoms. You might experience a rapid heartbeat, chest pain, difficulty breathing, intense fatigue, tremors, or even numbness and tingling around your mouth and fingers. These terrifying physical responses are why so many patients think they have a life-threatening illness. Because of these physical symptoms, patients often seek repeated treatment at emergency departments. They undergo unnecessary blood tests and ECGs, only to be told there's nothing physically wrong with them. I know this can feel incredibly frustrating and scary, but the truth is the physical manifestations are rooted in a psychological cause that needs to be addressed. There are several types of anxiety disorders. You might have generalized anxiety disorder, where you worry excessively about everything, or you might experience sudden panic attacks, specific phobias, OCD, or post-traumatic stress disorder. These often go hand in hand with other conditions like depression. Understanding which type you have is the first step toward getting the right help. Many Malaysians ignore these signs because of the stigma around mental health. They try to just tough it out. But ignoring an anxiety disorder can be debilitating to your overall well-being. Think of it like ignoring a broken bone. It won't heal properly without medical care. Your brain needs treatment just like any other organ. Now that you understand the cause, let's talk about what you can do. First, look at your lifestyle. Quitting smoking and reducing your caffeine intake are crucial steps. Caffeine and nicotine can artificially trigger that fight or flight response, making anxiety symptoms much worse. Cutting them out can significantly lower your baseline stress levels. Second, practice deep breathing and relaxation techniques. When you feel panic rising, taking slow, deep breaths actually sends a physical signal to your brain's nervous system. It tells your internal security team that you are safe, helping to shut off that false alarm. Try inhaling deeply for 4 seconds, holding for 4, and exhaling for 6. Third, don't underestimate the power of regular exercise. Physical activity naturally burns off excess adrenaline and releases endorphins, which are your body's natural mood elevators. Even a simple 20-minute daily walk in your neighborhood can make a massive difference in preventing anxiety buildup. It's one of the best natural treatments available. Most importantly, please seek professional help before the symptoms become debilitating. Many Malaysians worry about what others will think, so let me put your mind at ease. Anxiety disorders are incredibly common, very well understood by doctors, and highly treatable with therapy or medication. You don't have to suffer in silence. If these symptoms sound familiar, please don't hesitate. Come and see our doctors at Klinik Temasya, or visit your nearest Klinik Kesihatan or Hospital Karajan. We are here to listen without judgment, explain your options, and help you get your life back on track. Taking that first step is often the hardest, but it's the most important. Remember, anxiety is a medical condition, not a personal weakness. This video is for educational purposes only. Please consult your doctor for personalized medical advice. If you have questions about anxiety, leave them in the comments and share this with someone who might find it helpful. If you found this useful, check out our video on managing daily stress.